After I finished all my treatment, I had many months off work recuperating. It was a slow and often painful experience. Getting back to a regular lifestyle can be quite a challenge. Although I was better, life was never going to be quite the same. Some of the things I loved to eat, my body could no longer handle, so my diet changed to suit the new me. My days of enjoying a glass of red also came to an end, although that seemed to affect my friends more than it did me. Different cancers and different treatments can leave you realising life can never be quite the way it was. But once you adjust to the different you, the new normal can be wonderful. I know I certainly appreciate life way more than I did before. And there are plenty of things you can do. And there are people ready and willing to help you get on with your life.
Physically, really, I recovered quite incredibly fast. The mental and emotional side, I think, takes much longer. And I was angry with my body, not with anyone else, not even with fate or karma or whatever you like to call it. But I thought, here have I've given up smoking, I've eaten all the right things, I'm the right weight, and I take exercise, and look what's happened. I might not have bothered. And then I thought, well, don't be silly. It might have been worse if you hadn't.
Once a major cancer treatment episode is finished, it is unfortunately not absolutely the end of interaction with a cancer centre. Patients need to be followed to make sure that the cancer doesn't come back, to make sure that side effects from the treatment go away, to make sure that new long-term side effects from the treatment don't occur. Initially, after cancer treatment, the follow-up is quite frequent, sometimes as often as 3 months for the first couple of years. This is because most of the problems that are going to occur do tend to occur in the first couple of years after treatment. If all is well after a couple of years, the frequency of follow-up does reduce, sometimes down to 6 months and then eventually to once a year. After about 10 years, we often return patients to the care of their general practitioners. But it's important to remember for the rest of your life, when interacting with the health system, that you have had a cancer. I try to say to people, forget about it most of the time, but if you're ever sick, do say to your doctor, I did have this cancer, could it be related? Just so that it's not forgotten about as the years go by. One of the interesting things that's happened with cancer in the last decade or so is that because so many more people are surviving, we are seeing so many more long-term implications of cancer and are realising that patients do need to be followed up with respect to their cancer and its survivorship issues for the rest of their lives.
It's a scary thing, and you go through a whole lot of phases, and it's always going to be in the back of your mind, I think. And I sort of don't like that. I sort of feel a bit that I wish I didn't have to have that, but it's there. And talking to the doctor, apparently that feeling gets less and less as you go further down the road, and you start to not thinking about if it's going to occur or reoccur. You start to think about, well, which holiday am I going to plan next, and, you know, those sorts of things. So it's always there, but I think it does get further away from you as the years go by.
One of the things that changes with a cancer diagnosis in treatment is that sense of security that our bodies have been there for us. We don't think about it too much, but things just go on as usual. But with a cancer diagnosis, there's this sense that everything's changed, that I can't trust my body anymore, that a recurrence could come back at any time. Often people describe that after their cancer treatment, any time they feel a twinge in the body, any kind of pain at all, the immediate thought is, that's the cancer coming back. That's a very normal part of living with a cancer diagnosis. You've had that experience before. You know that things can happen in your body that you don't want. It's important, though, to put that in perspective. For instance, if you've had a long day of gardening the day before, it's quite likely that the back pain is related to moving in ways that you're not used to doing. However, if you're not able to find reasons for it, it's important to go and talk to your doctor. It's not likely to be the cancer, but, you know, it may be, and it's important to listen to what your body's saying and have things checked out.
Often at the end of treatment too, there's that sense of now what? What do I do with my life? While people around you are celebrating because the treatment's finished and they think everything can get back to the way it was. And it won't get back to the way it was because of this huge experience that you've had. But there's going to be a new life and a new you, and often people will reevaluate their values and their life goals at this time, and so there's a new direction. Another group program that we have is called Staying Healthy After Cancer. This is a structured program and it runs for 6 weeks, and each week you have a 2.5-hour session. The aim of Staying Healthy After Cancer is to assist people to manage the emotional demands of a cancer diagnosis, to manage the physical demands following a diagnosis and treatment, and also to encourage people to live their daily lives as much as they were before as is possible. Topics covered in the program centre around techniques so that people have a tool that they can use to manage difficult emotions such as frustration, depression or anxiety, to manage the physical symptoms, so short-term management, which might be distraction techniques or better breathing techniques, and to help people with relaxation techniques, which might be visualisation or muscle relaxation techniques, and also to encourage physical activity and a healthy diet. We also cover communication skills, so that's communications both within the family and friends and in your social networks, as well as with the health professionals.
Having cancer is obviously a major life event, one that changes a person's life forever. When patients are newly diagnosed, they often say to me, "I just wish I hadn't had this," and I can understand that. But unfortunately, you can never go back to not having had cancer once you have been diagnosed. However, most people find eventually that having cancer somehow enhances their lives. We don't entirely understand why this is, but we know that people with cancer have a very strong desire to live. And this possibly changes the way that people look at life.
Post-cancer life, I think it's different. Well, one, I gave up work, but that wasn't difficult. But I've since filled my day with, I think, probably even more nicely arduous tasks these days. But what it's done is given me the chance to assess my life, make the changes, which I needed to make because I had a whole heap of issues to face, which I've since faced, and get on and try and do something with my life which is more productive, but do it at my time, my pace, and try and give a little more to people rather than what had been my case.
Pre-cancer, I thought I was bulletproof, that I was always healthy and thought I'd remain so. But I realised that I wasn't bulletproof, and every day is very important, not to let a day go by and sit home and moan and groan about things. Get out, do things, be glad I'm still here. Still go for holidays, do the things I want to do while I can.
If you'd like to find out more about this chapter, please use the resources on this page.